Hey, Savvy Beauties. It's your girl, Crystal P, the Beauty MP. As always, back with another video. And today, let's see, I wanted to discuss why hormone therapy is personalized and why everyone gets a little bit of a different treatment plan depending on what stage that you're in. So, for those of you who don't know me, my name is Crystal Parker. I own a med spa here in Southern California, in which I specialize in hormone therapy, menopause, perimenopause, weight loss, IV hydration, and aesthetics. My YouTube channel is centered around all things beauty and wellness. And if you guys have been watching, then you know that I love hormone therapy and helping women to get their hormones balanced because we do not have to live how we've been living. And if you know the symptoms of hormone deficiency or fluctuating hormones while you're in perimenopause and menopause, then you know what I'm talking about. So today's video, I just wanted to kind of give you guys some insight on how practitioners dose you, what they dose you with, how we come up with dosages, and more importantly, which treatment option is best for you. So to start, there are a couple different treatment options. One is pellet therapy, and that is mainly replacing testosterone, not even replacing it, but adding testosterone to a woman's body, the bloodstream, and also maybe some estrogen. That depends on if the woman is or person is hormonal or not. I'm sorry, is in menopause or not. So, or a late stage perimenopause where periods are fluctuating, and that means that our estrogen levels are low. And then when we stop having periods, then a woman's estrogen level can go very, very low to almost non-existent because they are not having monthly periods. So what happens when estrogen is low? That's when you get the mood swings, the irritability. That can also happen a little bit before, but those things and hot flashes are usually associated with more of your decrease in estrogen. So that also includes vaginal dryness. Some women describe painful sex. Having sex feels like shards of glass is cutting them in the nether regions, and we don't want that, right? Who wants to live like that? Who wants to have sex like that? And we should be able to have sex for as long as we want to, and not be constricted or not able to do so because we are feeling like shards of glass are cutting us every time we partake. So those things are what estrogen helps with. So estrogen is very, very important. Not to mention, estrogen helps with brain health, bone health, and also cardiovascular health. So the number one killer of women or everyone is cardiovascular disease. Okay, so that's having heart attacks, strokes, all the things. Okay, so we want to prevent that, and a way to prevent that is by having estrogen therapy. So back to the different prescription plans. So if a woman wants pellets, okay, I will go over her medical history with her, do a in-depth consultation with her, do her blood work, and see where the levels are at. But the majority of the time, I am dosing and basing my prescription regimen off of the signs and or the symptoms that the woman is having. So if we're going down the pellet route, like I said, there's either testosterone or estrogen when it comes to that. So if a woman is in menopause, done with periods, or if a woman is having periods and you're skipping months, we will give you a little bit of estrogen and we are giving you testosterone. Those are in pellets, and I have a video on pellet therapy and what all that is. So you can watch that video. But we're replacing it through pellets. Pellets are something, a little small pellet that's implanted, and your body absorbs it over a couple of months, and you're getting a consistent flow of testosterone and estrogen to help balance things out. The other treatment options are creams, patches, and pills. So you can take estrogen by mouth, and you can but you cannot take testosterone. Is not recommended to take testosterone orally. So you are mainly taking your estrogen in either a cream, patch, or a pill. And you're doing you would, if we added testosterone, depending on your symptoms, it also depends on symptoms. So testosterone, things like brain fog, mental clarity, sex drive is definitely linked to testosterone, vaginal dryness. Testosterone can help that as well, and a whole host of other things. So We with testosterone that is given in a gel. It's usually placed in the inner thigh areas where I like to tell my patients to do it, and it's just a small pea-sized amount daily. And as we build up the testosterone levels, also with estrogen cream, you're going to rub it inner thigh, a small pea-sized amount inner thigh every night, or a couple, or sometimes we give you a boost for 2 weeks, and then you switch it to twice a week. You're giving yourself some estrogen. So those are the big ones, right? So estrogen, testosterone. Then if you are in menopause, so you're not making or you're not having periods anymore, when we're giving you the estrogen that's building up the that is when we're giving you the estrogen, we also need to combat, I don't want to say combat that, but we also need to supplement that estrogen with some progesterone. And what progesterone does is it helps build up the uterine lining, and it helps to protect the uterine wall when we are taking estrogen. So if you're a woman in menopause and you're on hormone therapy, most likely you're going to be given progesterone as well to protect the uterus. Okay, that protects you from bleeding. And if you're in menopause and you haven't been bleeding, especially if you haven't been bleeding for years, the last thing you want is to start this new therapy that's supposed to help and you start bleeding. So we give the progesterone to protect the uterine, the health of the uterus, and to prevent other things from happening. So you may be given some progesterone, but you could be given progesterone even if you are not in menopause, because progesterone helps with sleep. And it is, if you think of, if you've ever had children, if you think of when you're first pregnant and you are so fatigued that you can't even stand it, that is a progesterone working. So of course we don't give you that much where you're fatigued throughout the day, and we also suggest that you take the progesterone at night to help from this, but it gives you a great sleep, and it just helps the anxious thoughts at night, that anxiety. So we can give you a low dose progesterone even if you aren't in menopause, but that's another personalized part of hormone therapy that we can add on, is the progesterone. Other things women get that I suggest are vitamins. So there's a vitamin called DIM that I suggest, and that helps to prevent testosterone converting into too much estrogen, because when you have too much estrogen, you get the opposite effect. So you get irrational thinking, you get mood swings, you get flying out the handle. Those types of things. So we don't want that to happen. So that's why we kind of regulate how much estrogen that you're getting. Other things we can also give you is cream. So if you are experiencing vaginal dryness or that atrophy that I said, when we lack estrogen, then that moisture that is down there is no longer happens. There's no moisture, so things start to get brittle and hard down there. That skin is very thin, so we have to keep it moisturized and lubricated. And a way to do that is vaginal estrogen. Very simple. Again, a couple times a week, you just take a small pea-sized amount, rub it in the vaginal canal, and that helps to keep everything nice and healthy and flourishing and moisturized down there. So you can do that at any age. Vaginal estrogen is like skincare for down there. Every woman, no matter what age, should well, not if you're like 20, but if you're mid 30s and up, every woman should be on a vaginal estrogen. It does not go to the bloodstream. It stays systemic. It does not go systemic. It just stays right where you put it, which is in the nether region. So again, twice a week. You don't want your husband or your partner to get in contact with the estrogen if you're taking it. Okay, so that's one of the reasons why some people do not like estrogen creams, because they are afraid that their husband can get it. And yes, if you put these creams on and you are in contact with your husband, the estrogen can rub off on him, and it can cause him to be irrational, moody, crying, breast tenderness. It can cause those things in men. So we do not want men to absorb any of that estrogen. So that's that. And if you're wondering if your husband can be on hormone replacement or hormone therapy, yes, they can, with the pellet therapy, also with the gels. Men can also do it too, and it helps with, like it helps with women, it helps with their muscular buildup, so it helps them build muscle, things like that. Also helps with sleep and confidence and mental clarity and things like that. So men can be pelleted as well, and they also can get some testosterone gel too. So I hope that helps. I have created a menopause hormone or not a menopause hormone, but a hormone tracker. And what this tracker is it helps to track the symptoms, because a lot of times people will come in and you might forget, or you only have these symptoms during your period, but you don't even realize or make the connection. And these things are very helpful when it comes to your clinician being able to prescribe what's right for you. So go ahead and click the link. It's going to be in the description below, where you can get this hormone tracker, and you'll also be added to my newsletter, in which I will share all things about perimenopause and things we can do to help in this fight of just becoming better, healthier women with hormone replacement or hormone therapy, and also other things such as good nutrition, better sleep habits, all those things will be highlighted in the newsletter. So go ahead and click that link. Also subscribe to the channel. I do a lot of talk here about hormone therapy, and also entrepreneurship and nurse entrepreneurship. But you can find lots of information on hormone therapy if that's what you're interested in. So please sign up for the hormone tracker. And you can also sign up. There should be a link to sign up to get a call with me. So if you are not in California, as of now, I'm only licensed in California. I'm looking to expand in the near future, like the next few months, into Arizona and Nevada and Washington. If you are not in one of those states and you want to hop on a call with me, you can hop on a call and I can give you kind of a strategy based on your symptoms. We can even get your lab work going. No, we probably can't do that because I can't prescribe lab work in other states, I don't think. But we can definitely go by your symptoms, and I can tell you what labs you need to have your primary doctor order for you, or I can even show you how to find a hormone specialist in your area if you have went to your doctors and they are telling you you're too young, or you're crazy, your symptoms have to get worse, or you're not having hot flashes, so you must not be in menopause. If you are hearing those things for your provider, please give me a call so I can let you know who you should be going to, or what questions to ask, or what to say to your provider if you are struggling with that. So I hope this helps. Thank you for watching. Make sure you subscribe to the channel, and please comment and let me know how you are liking this content. All right, see you guys soon.